So what happens if you ignore a hernia for years? Well, you're lucky. Hernia generally are not an emergency conditions. Basically, it's a bulge in the abdominal wall, or it could be elsewhere also. It's a bulge where contents of the intestine or something called as the omentum is popping out. There are people who proudly come and tell that I've had a hernia for 20 years, it's not troubled me. But they have been very, very lucky, or they have a relatively decent lifestyle, or the hernia is not very large. These are the main factors. But in case you're ignoring a hernia for ages, what happens? One, the hernia size will keep increasing. The contents, that is what happens is the intestine that is going in and coming out, with time will go in and get stuck, and it will form something called as adhesions or bands within, and it will get stuck there. So many people, though they have a hernia, some mild symptoms of constipation and diarrhea occasionally that's happening, but many of them are not able to correlate this because of the hernia issue. If your tubing of your intestine is not intact, it will cause digestion issues. So long-term hernia is mainly related to digestion, pain, and the size of the hernia that is increasing. Obviously, the type of hernia also matters. In case you have an umbilical hernia, that is your belly button hernia, once the size of the hernia goes on increasing, there is no option of undergoing a laparoscopic surgery. You will have to undergo an open surgery, and probably the extent of surgery, the time of surgery, all these factors get increased or prolonged. Now, let's say if you have an inguinal hernia, that's your groin hernia. Times when I used to study, there were people that used to come with a inguinal or a groin hernia where the scrotum is come up to nearly mid-thigh or sometimes even till the knee level. And they're either embarrassed to get it showed, or they don't feel it's a problem. But in such cases, what happens? You develop fungal infection because of the constant sweating that happens. You can develop wounds on your scrotum as well as your thighs. So leaving a hernia to such a large extent, lot of intestinal contents go in and get settled down there, and your body gets used to that. Now let's say we do a hernia surgery, we push everything internally, your intra-abdominal pressure increases. So you may have breathing difficulties also during or post-surgery rather. So do not wait for your hernia to increase in such a large size. Reasonable amount of time. Always, I tell all my patients, hernia is not an emergency suddenly, but always plan it as early as possible. Consider your, let's say, your work schedule, your children's school timings, whatever. Consider all these factors and get it done at the earliest. Smaller hernia, faster recovery. Larger hernia, open surgery, prolonged recovery, more complications. Hope this was useful, and in case you're suffering from hernia, seek the help of your surgeon as early as possible and sort it out as early as possible. Thank you.